Hello, I'm going to present regarding the adolescent drug abuse in the Canada. We are a group member of three, myself Hamza Patel, Jasmine Kaur, and Rupinder Kaur Sandhu. Starting with the introduction, overview of adolescent drug abuse in the Canada. Adolescent drug abuse is growing concern with more experimenting with more youth experimenting with substance abuse at the early age. Second is the purpose of this community assessment that's explore the factor of the contributing towards the drug abuse. Third one is importance of addressing adolescent drug abuse, specific in Canada. The fourth one is outline of this presentation that will cover the rationale of choosing this community assessment method, community strength and challenges and strategies. The first one is starting with the rationale. That's why we choose this particular topic. As the adolescent are vulnerable and at the risk of at risk population because they are having hormonal imbalance at this specific age, and they are more susceptible because of peer pressure. And second reason is increasing rates of the substance abuse in the youth. We can compare the older adults and the younger adults. Younger adults are more, according to 2020 government, the younger adults are more and the teenager are more prone towards the alcohol and cannabis use. The third one is early intervention can prevent the lifelong addiction issue. If the younger adults are more prone and they are using the addiction things, and it's going to be continue for lifetime if we are not going to intervene them, and it's going to ruin the whole life of our young adults. So that's why early intervention can prevent their life. The fourth one is impact on the physical, mental health, and social well-being of individual. Drug use affect brain development, emotional instability, and for their future opportunities, according to CMHA. And as one can mention, one mentioned that if we gonna inculcate the good manners in the children, it's gonna be for them. It's gonna be lifelong. In the same way, if they are using this substance abuse, and if we are not going to prevent them, intervene them, it's going to be in them for the lifetime. The next slide will be uh, defining the community. In the defining the community, adolescent, we why this specific age we are choosing is 12 to 19, and the location is we are choosing all across the Canada. Both urban and rural areas considered to be understand regional differences. And according to statistics of youth, 60 percentage reported of substance abuse by below the age of 20 by.
So, as my friend Hamza, he already explained about the community parameters. So now I will explain about the type of assessment chosen. So the first one is needs assessment and Grid-sheet survey. So it use both methods ensure a thorough understanding of the community. So windshield survey observes the community characteristics and risk factors, provides visual observation of neighborhood conditions. Combination of method provide both visual data and visual insight. So it ensures a comprehensive and well-rounded assessment. So now I will explain the rationale of the assessment methods we have chosen. So the first one is needs assessment. It gathers qualitative and quantitative data through surveys, interviews, and statistics. So like this assessment is basically using qualitative and quantitative data, like quantitative and qualitative data through surveys, interviews, and statistics, includes both statistical trends and personal experiences. Windshield survey provides a visual representation of risk factors, reveals physical and environment factors that contributes to a drug abuse. Both methods ensure a comprehensive community profiling approach. So like if like both the methods like need assessment and Windshield survey, both of them combines empirical data with the observational insights. Now I will explain my project goal. So the first project goal is ensure community resources. So we have to enhance the community resources which strengthen your youth centers and addiction support services. The next one is train school staff and parents on early intervention. So we should promote the early intervention, improves early detection of drug use behaviors. And the next one is implement peer-led program support programs, engage youth as a part of the solution. So we are engaging youth, like supporting the peer-led support programs. And the next one is promote education campaigns to reduce stigma. So increase public awareness and this increase public awareness and reduce judgment. So now I will explain the information sources we have used. So the first one is Canadian Center on Substance Use and Addiction. So this one is provides insight into youth substance use trends. And the next one is Canadian Mental Health Association, offers mental health perspectives on substance abuse. So the next one is Government of Canada reports on youth drug abuse. So it prevents a national statistics and policy insights. And the next one is National Institute on Drug Abuse. So it basically focus on research on adolescent addiction and treatment options. So the last one is Statistics Canada of official data on drug use prevalence in Canada. So now I will explain about the analysis. So the first one is limited access to mental health addiction services. So rural area face shortages of mental health professionals. So basically the rural people are more using drugs because they don't have any mental health and addiction services support. And the next one is stigma and lack of awareness prevent youth from seeking help. So due to stigma and they are not aware about the help available. So this one is further leading to fear of judgment and discouraging the people from seeking the treatment. So the next one is barriers in rural and undeserved areas, so which is further leading to limited resources hinder intervention efforts. So because in rural areas, like much resources are not available, so more and more people are just indulging into drug addiction. And the last one is challenges slow progress in addressing the issue. So resource gaps make it harder to achieve the effective results. So these are all the things which are just leading to more drug addiction in youth. And now my friend Rupinder, she will further explain about the drug analysis. Thank you.
Here I am going to discuss about data analysis. This paragraph illustrates the this graph illustrates the prevalence of adolescent substances use in Canada. The data highlights the most commonly used substances among youth, with alcohol being the most prevalent is 55%, followed by cannabis 35%, opioids 15%, and the substances are 10%. Next is capacity building strategies. This enhance community resources, strength, youth center, and addiction support services. Train school staff and parent on early intervention. Improve early detection on drug use behavior. Implement peer-led support program that engage youth as a part of solution and promotes education campaigns to reduce stigma that increase public awareness and reduce judgment. These are the organization and services involved. The first one is Canadian Mental Health Association. It provides mental health support, offer counseling and crisis intervention services. Second one is local public health units. These deliver religion health programs, conduct public health education on the mental well-being. Third one is non-profit organizations supporting youth mental health that offer accessible community services, provide peer support and mentorship programs. The last one is Youth Focus Addiction Program. It is specialized services for the youth addiction, support family involvement in the recovery process, educate youth on substance abuse prevention and treatment options. Advocacy and ethical consideration. Ethical consideration emphasize the importance of equitable access, ensuring that all adolescents, regardless of their geographical location or socioeconomic status, have access to addiction treatment services. Advocacy initiatives should address services gap in rural and under-reserved areas, promoting resources expansion and culturally sensitivity intervention. It also initial to address stigma, which often prevent youth from seeking help through public awareness campaigns and education programs. Here is the conclusion. The assessment highlight the early intervention is crucial in preventing long-term drug addiction. Evidence shows that school-based prevention program and parent education significantly reduce substance essential rate according to Canadian Centre on Subsistence Use and Addiction 2021. Early Acting early can prevent substance misuse from escalating from chronic addiction and related health problems. The assessment underscored the need for more accessible early intervention program in school, healthcare settings, and community centers. These are the references we used for our content. Thank you.